Quinn was born after a fairly uneventful pregnancy at 38 weeks, and we had no reason to think anything was wrong. But he was born blue and clearly not breathing properly. So they whisked him off to the special care nursery, not really saying much about what was happening or where he was going. A couple hours later, I came out of recovery, and the doctor drew us the first of what would be many, many pictures of the inside of our son drawn on paper towels. And basically that he was born with an incomplete esophagus, and the parts of his esophagus that were there were attached instead to his airway. And I remember the doctor, I said, could you write it down? And it was the first time I had heard esophageal atresia with tracheoesophageal fistula. And I was postpartum and I couldn't remember it. And I remember saying to my husband all the time, what's it called again? So after 3 days at the local hospital, they sent him to Children's. And he had surgery, his first surgery when he was 3 days old. Oh, and that surgery was 8 or 9 hours long, attempting to reattach his esophagus, but there wasn't enough to reattach. So at that point, they put a feeding tube in. And I remember the surgeon coming out of surgery, this long surgery, and he was sweaty and tired. And he said, we weren't really able to do what we wanted to do, so we'll try again in 3 or 4 months. And I looked at my husband and I said, did he just say 3 or 4 months? Like, we're going to be here for 3 or 4 months? And the surgeon said, oh, well, don't worry, Mrs. Fowlie, because, we're going to develop quite a relationship over the next 7 or 8 years. And I said, I looked at my husband again and I said, he just said 7 or 8 years. Long story short, after about 3 months, after about a month, they discovered he actually also had, in addition to this esophagus problem, a hole or a cleft between his trachea and his esophagus. So essentially, whenever he would get upset, all of his oral secretions would go into his airway and block his airway. So when he was 4 months old, they gave him a tracheostomy. And he stayed in the hospital till he was, at 11 months old, there was a whole series of different operations that he had, but at 11 months old, they were finally able to attach his esophagus, at least in enough of a way for him to be able to swallow most of his own oral secretions, his own saliva. And so for the first time at 11 months old was the first time he wasn't attached to the wall by a tube. It was interesting raising a baby in the hospital. And people always say, I don't know how you did it, but you do it because there's so many other people, there's so much support there. And I have to say the team in ICU, their whole effort was around trying to make it as homey for us as possible. So I can remember the first time I came we started out in the special care nursery, and after he was trached at 4 months, we got moved to ICU. So I remember the first time I came into ICU, and he wasn't in his crib, and he was on the floor on a mat, surrounded by toys, and a nurse with an Elmo puppet, and it was. And I thought, okay, this is good. This is going to be okay. Almost from the beginning, we did all of the what would be normal baby things with him. We did all his baths. We learned to change his trach ties, and we did that. Certainly playing and cuddles and all of that stuff they made as easy for us as possible, which is great because it's not the way you expect to have a baby.